Hello, everyone, and thank you so much for joining me on this webinar on reopening Revelry. I'm so excited that this pandemic is almost over, hopefully. And here in California, we have plans to reopen everything starting June 15th. So I know I'm feeling really excited about that. It's been a long time since I've seen a lot of my friends and gotten to hug them. And I'm really just looking forward to reconnecting and celebrating with folks. And I'm sure you are too. And so I thought that it would be helpful to share some substance use management information before everything opens back up, because I think we're all going to be in a very celebratory mood. And I just want to make sure that everyone is partying safely out there and minimizing as much risk as possible. So, what I'm going to do today is share some resources with you so that you can inform yourself on different substances that you might want to be using. Remembering that if you've been in quarantine, you probably haven't been using as much substances as you were before. And so your tolerance level is going to be lower. So just kind of thinking through different safety tips to make sure that you're having as much fun as possible and being safe. I do want to share trigger warning, just that there are images of substances in this presentation. So if you think that you might be triggered by seeing an image of a substance, you can turn the brightness down on your computer. You can close the top of it most of the way. You can put on wireless earbuds and do something else while you're listening. Just wanted to give you that heads up. One of the main reasons that I wanted to put together this webinar is because here in the United States, overdose deaths continue to surpass COVID deaths and tend to be one of the leading causes of death among young people in this country. So we still have an overdose epidemic happening, and overdose death is 100% preventable. And the way to do that is to educate people on the substances that they're using. So my hope is that you can take this information, reduce risk, share it with your friends, so you can get out there and celebrate responsibly. So it's 2021, the party's going to be great. And that also means that for some of us, we're going to be feeling a lot of social anxiety. It's been a long time since we've seen people in large crowds. Maybe some of us have gotten really comfortable with our new introvert lifestyles. But I know for me, any kind of social situation includes a little bit of anxiety. And that means that we're more likely to use. We may be likely to drink more, or to smoke a little bit more pot, or just to try to self-soothe that anxiety in some way. So again, just be mindful with yourself. Remind yourself of what your needs are, what your boundaries are. It's still totally okay to say no to social things. Give yourself that permission. Give yourself the permission to stay home and read a book, or take a long bath, or watch a movie by yourself. Just because most people are going to be out there partying and socializing and getting together doesn't necessarily mean that you need to do that if you're not feeling up to it. So be honest with yourself about what you're really ready to take on. Whatever pace you go at is the perfect pace for you. And be mindful of how social anxiety might be showing up for you as we start kind of reintegrating more into the social environment. So the number one concept that I want you to take from this webinar is to start low and go slow. Remember that for many people, it's been difficult to get access to substances. And so whatever amount, whatever dose you were using before the pandemic started is going to be a much higher dose than you need now to get the same effect. So go on Arrowhead. I'll share on the next slide with you some more information. Google it, figure out what the standard doses are, and start at the very lowest threshold dose and kind of work your way up from there. Remember, you can always take more, you can't take less. So, the other thing is to kind of pace yourself. I think we're all going to feel really excited to be seeing each other and partying and dancing again. And so, remember to pace yourself. There are going to be lots of parties, lots of opportunities to have fun and to connect. So, you might think about like looking at your social calendar out on like a piece of paper, and really thinking about like a moderation plan. So if I'm going to something Friday, Saturday, Sunday, How do I want to think about my substance use, and how do I want to pace that over the course of the entire weekend? It might be helpful to set some goals for yourself. I don't want to have any more than 4 drinks in a day, or I don't want to smoke more than one day in a row, and see if you can plan out your use over the course of a day, over the course of a weekend, over the course of the week, whatever it is that however it is that your social calendar is starting to show up. So some really helpful resources. If you're not sure about the substance that you want to try, if it's just been a long time and you're thinking about using something again, Google it, look it up on arrowhead.org, look it up on Blue Light. Arrowhead and Blue Light both have user forums. So you can learn from other people who have been using the substance, any issues that they've been encountering, combinations that were good, combinations that weren't so good. So inform yourself as much as possible about the substance that you want to use, how to use it, any kind of potential consequences as in terms of like addiction potential, withdrawal potential, combinations of substances. All that info is available for you online. And Arrowhead really is such an excellent source of information. So check them out if you haven't already. The other resource you can check out is TripSit. If you think that you're going to be combining substances, they have this really useful chart, which you can find on TripSit's website. And I know that it's also been converted into an app. So if you prefer that format, you can get more information that way too. But this is just going to inform you on the relative safety of these drug combinations. So if you're thinking about combining a psychedelic with cannabis or ketamine with MDMA, just check out the relative safety of those combinations. And this chart only allows you to check on the safety of 2 substances. And I know that sometimes we're using more than 2 at the same time. So, just be mindful of that when you're looking at these drug combinations. So another thing I want to cover with you, another tool is called drug set setting. So this is really helpful for any kind of um, state of altered consciousness that you are going to embark on. You want to take into consideration the drug itself, the type of substance. You want to think about your mindset. How are you feeling? What is your mood going into this? And you want to think about the environment in which you're going to be altering your consciousness. So this is part of moderation planning. This is part of substance use management, responsible drug use. And so when we can be intentional and mindful and thoughtful about our experiences, we're less likely to encounter consequences. We're able to minimize risk. And what that means really is that you're going to have a better time. So take the time to think about this, write it down if that's helpful to you, talk to someone about it, so that you're really clear on your intentions and your safety going into an altered state of consciousness. So the drug, again, you're going to be thinking about the class of drug. Is it an upper, a downer, a psychedelic, a dissociative? You want to think about the source. Where am I getting this substance from? Is it from the dark web? Is it from someone that I know? How much of a dose should I be taking? So again, if you're coming back to this substance after a while, you want to start with a much lower dose. And Arrowhead has helpful information about like threshold, light, medium, heavy doses to kind of give you a sense of what might be appropriate for you given the experience that you want to have. Consider the route of administration and the relative safety of that route. Think about the timeline of the substance. So is this substance going to last 12 hours? Is it 30 minutes? How much time does it take for the substance to come on? How long does the peak last? What does the come down look like? Consider any kind of equipment that you might need. And again, ensuring that you're being safe and hygienic around that equipment. Consider the addiction, withdrawal, and tolerance risks associated with this substance. And then again, make sure that you investigate and research any combinations if you're going to be using more than one substance at a time. The set has to do with your mood. It also is a way for you to check in with yourself about what your limits are. How much do I want to use? Why do I want to be using? What is my history of relationship with the substance been in the past? And then also considering your physical health. Are there any physical considerations to take into account given the substance that you're thinking about ingesting? And then the setting is the environment. So who are you with? Where are you? But also the legal environment. Are you using a substance that's, decriminalized, that's legal, or is there some risk involved in using, especially if you're going to be in like a social outdoor public setting? Okay, so from here, I'm going to talk some more about specific substances. So let's start with alcohol, certainly the most popular of substances, and one in which we've definitely seen an increase in intake since the pandemic. I think there's been like a 25% increase the last time I checked. So with alcohol, here I'm sharing the standard drinks so that when you're thinking about how many drinks do I want to have in a day or in a week, these are the measurements that you're going by. 12 ounces of beer, 8 to 9 ounces of malt liquor, which has a higher ABV, 5 ounces of wine, and 1.5 ounces of alcohol, which is about 40% alcohol. If you have solo cups, those lines are actually really helpful markers, right? So that little line on the bottom is 1 ounce of liquor. The second one up is 5 ounces of wine, and the third one up is 12 ounces of beer. So that's a way to kind of keep track. With alcohol, definitely check your tolerance. If you have been drinking less, you probably already know that you're not going to need as much alcohol to feel the effects. Try to keep count, try to set a limit for yourself of how much you want to drink. Again, especially if you're coping with social anxiety, alcohol is really good at erasing that in the moment. But there is rebound anxiety that can happen the next day from having too much alcohol. So be mindful of that. Try to eat before you drink. Try to drink water while you're drinking. See if you can find that sweet spot of being buzzed, if that's what you're after, without getting overly intoxicated, where then you lose control and then it's not any more fun. So with alcohol, the dose is really dependent on your body weight. But in terms of cancer risk, the American Cancer Association came out early last year with some new data saying that about 7 drinks a week is the threshold for managing cancer risk. So anything over 7 drinks in a week puts you at a higher risk. So something to consider, especially if you have a history of cancer in your family. All right, next, let's talk about cannabis. So if you are a regular cannabis user, you know that flower versus vaping and smoking versus edibles are totally different experiences. And so it's really hard to give dosages for cannabis. You kind of just want to go really slowly and start with a lower dose. Particularly with edibles, less is more. Make sure that you're staying maybe in that like 5 milligram range, especially if this is your first time. If it's your first time, 5 is probably a lot. You might want to start with 2.5. So remember that you can always eat a little bit more, but you can't go back. And edible cannabis tends to have a much more psychedelic experience than smoked or vaped cannabis. Which can be a little bit more like of a cognitive heady high. So just be mindful that they're very different experiences and that the amount you consume is going to be different. In terms of risk reduction with cannabis, the data is still kind of out, especially since we're just now looking at data with it being regulated, being able to look at THC levels and how that affects the brain. We definitely know that for people under 25, you don't want to smoke regularly, and you want the THC of your flower, if you're smoking or vaping it, to be in about the 15% THC range, which you may be surprised because that's probably a lot lower than what you've been consuming. So one benefit of having the substance regulated now is that we can see how much exactly how much THC we're taking in. So try to stay, if you're under 25, try to smoke very, very seldomly. Usually the advice I give kids is like once a month, if that, just because your brain is in the process of what's called pruning. So it's still in the process of being fully developed. And under 25, we see that there's a much more significant impact to the learning centers of the brain. And if you have any kind of neurodiversity, that can be extend up to like 30 years old. So if you're someone with like ADHD, dyslexia, sensory processing, learning differences, that sort of sensitive period of pruning may extend well into your late 20s, early 30s. So just something to be mindful of again in terms of risk reduction. And for the rest of us, it's still going to affect memory and learning, but not have as significant of an impact. So a little bit more regular use could be okay. But again, it seems like the threshold really is around that 15% THC level in order to minimize risks associated with cognitive processing and executive functioning. The other risk reduction to take into consideration is smoking spliffs and mixing cannabis with tobacco. So, all of the risks that come with nicotine are going to be added to the risks associated with cannabis. So, nicotine is a vasocompressor. So, regular use can lead to cardiovascular health issues. With anything that's smokable, there's also a cancer risk. So again, that's a risk with very, very, very regular use, daily use. Smoking most days. So be mindful of all of that. So again, the websites like Arrowhead, Google, Blue Light may or may not be helpful with cannabis because each strain is completely different. So your best bet is to kind of try to stick to the lower THC levels if you can and play around with the different strains to see which one is most pleasant to you. For some people, sativas are more pleasant. For some people, they prefer indicas. Almost everything out there is some kind of hybrid now, but you can experiment a little bit and see what works best for you. Okay, psychedelics, of which there are many, many, but here I'm going to share some dosages for you with LSD, psilocybin, and DMT. So this data comes from Arrowhead, and this is what I was mentioning earlier. Again, if you're coming back to it after a while, try to start with a threshold or a light dose if what you were consuming was higher than that. Again, the psychedelics all have very different experiences. So the altered states of consciousness are going to be varied. With psychedelics, set is super important. Making sure that you're in a positive headspace. And if not, if you're wanting to do some therapeutic work, some healing work with psychedelics, then making sure that the setting is really tight, really safe. You're with people who are not only going to be supportive to you, but are going to give you a very high quality of support to help hold you through any kind of difficult experiences that you may have. If you're more on the side of wanting to celebrate with psychedelics, again, set and setting is important. Make sure that you're in a good space mentally and that you're going to be with folks that you feel safe with. Always a good idea to have someone who's not on psychedelics in case something does go awry. That person can get a hold of help if necessary, or that person can act more as like a guide to help contain the experience for others. So do more research on Arrowhead, and so you can learn and look at the user vaults so that you can get more information about how the different psychedelics are experienced. Okay, uppers. So cocaine, Adderall, meth. Again, this is something that Arrowhead doesn't really give specific dosages for because it can be so idiosyncratic, so unique for each person, and is also highly dependent on the method of administration, the route of administration, whether it's oral or snorting or injecting. With uppers, they do provide some guidance around cocaine, saying that usual dose is around 30 to 70 milligrams. So that would be like one thin line of cocaine would be around 30 to 70 milligrams. So you might consider getting a scale if you're using powder substances so that you can track how much you're using. Again, less is more if you're coming back to it after a while. With the uppers, always want to be mindful, like if you're insufflating, if you're snorting, making sure that you're never sharing straws, never using dollar bills, that kind of thing, because some diseases are communicable through mucous membranes like hepatitis. So make sure that you're not sharing equipment if you're insufflating. And of course, same goes for injecting, making sure that you have your own equipment, that it's sterile, that it's hygienic. Some risk reduction with uppers, being careful not to mix them with downers. That's really hard on the heart and can have really severe cardiovascular health effects and consequences. All right, downers. So opiates, benzos, GHB. Again, there are lots of different substances here. So go to Arrowhead, research the specific substance that you are interested in to get some information on dosage. Especially with downers, you really want to be careful. There's a higher risk of death from overdose. If you use downers, especially opiates, always a good idea to have Narcan on hand. Here in California, you can get Narcan at any pharmacy without a prescription. And if you aren't able to pay for the full cost of Narcan, I know that in San Francisco, you can go to the Department of Public Health and they will give you Narcan for free. There are also many NGOs all over the United States that gift Narcan to people who need it and who want it. So really, there's no excuse. It's super easy to administer. It's just a little puff into the nose and a second puff if the person doesn't respond to the first puff. If you're using opiates, if you love someone who uses opiates, please have Narcan on hand. So again, because the dosages are so different, I'm not going to go into the specifics, but go check it out on arrowhead.org. All right, so MDMA, probably going to be a lot of MDMA use in this next month here, at least here in California, as people are reconnecting and dancing and having a good time. So again, you want to be mindful of the threshold dose for you. If it's been a long time since you've been taking MDMA, try to start on the lower side and give yourself some time. Remember the timeline for all of these substances. And how that timeline is different for everybody. So for someone in your group, it may hit really fast. For someone else in the group, it may take them a little bit longer. And that just has to do with how our body metabolizes the substance. So, check in with yourself. Just because other people are re-upping doesn't mean you have to. And give your body some time to metabolize the substance before you re-up. Some risk reduction with MDMA. Really, you want to try to give yourself 6 weeks in between sessions to give the brain time to recuperate the serotonin stores and serotonin receptors. Okay, so moving on to ketamine. Here are some threshold light, common strong K-hole dosages for you to manage your use. Based on body weight, if you're going to be injecting or taking or insufflating. And I know some people also like to boof ketamine. So look at these milligram totals, get yourself a scale, weigh it out so that you are able to have a good time. Some risk reduction with ketamine, just making sure that you don't mix it with alcohol. That's really not a good time, folks. So, there's also a risk of death if you've been drinking a lot and then take a lot of ketamine. You really want to be careful. It could suppress your breathing rate and your heart rate. So you want to be mindful of that. Again, check out the Tripsit drug combination if you're thinking about using ketamine in conjunction with other substances, and check out the relative safety of doing so. All right, before I go, I just want to encourage you to get a drug testing kit from DanceSafe. You can get the whole set. I think it's maybe like about $150, and that'll test, your substances 70 times. So it's worth the investment. Or if are only interested in testing a specific kind of substance, you can go on their website and see whether you can just get one of these reagents, because you don't necessarily need all of them. But I want to encourage you to test your substances before you take them. You can also get fentanyl testing strips on dancesafe.org. I just want to remind everyone that fentanyl contamination continues to be a thing. It is not limited to opiates. We're seeing fentanyl contamination in cocaine, in ketamine, and MDMA. I'm not sharing this with you to be fear mongering in any way, but just for you to be mindful that this is a risk that we are now unfortunately seeing across many substances. Drug testing kits are super easy to use. They're super fun to use. So especially if your use is part of like a bigger social scene, consider going in on it together, and sharing the drug testing kits so that you can be sure that what you think you're ingesting is what you're ingesting. All right, so that's it for me. If you're finding that you want more information about substances, about how to change your relationship with substances, how to use more responsibly, you can check out my book. It's called Power Over Addiction. It is available on Amazon, or you can sign up for my course called Just Say No at courses.poweroveraddiction.com/just say no. If you have any other questions or you need help being connected to any other resources, please don't hesitate to reach out. Shoot me an email, text me at this number, give me a call. I'm always happy to help and connect you to any kind of support that you may need. Thanks again for checking out this webinar. Have so much fun and be safe. Take care.